Personas que viven con una enfermedad rara. Vamos a comenzar con la representante de Genetic Alliance, Natasha Bonhomme. Es vicepresidenta en esa organización, en Genetic Alliance, con quien tenemos desde hace mucho una relación muy estrecha. Durante 6 años ella ha estado de algún modo observando las actividades de niños y las actividades en términos de las madres, como directora en Estados Unidos del screening neonatal en el Clearing House. Natasha va a hablar sobre la tarea que realiza Genetic Alliance. Así que, Natasha. There. If you prefer, you can. No, esa no es la otra.
Bueno, esto sucede hasta en los países de primer mundo, acá en los de mucho corazón también sucede.
Okay, great, thank you. Thank you, and good morning, everyone. Thank you so much for letting me present to you this morning. I've had such a great time here listening to all the other sessions and presentations. I think this has been an excellent meeting, and I feel very fortunate that I've been able to speak to so many people and get so many different perspectives. I'm going to speak a bit about the how and why of international collaboration within disease advocacy groups, and also a little bit about the tools of Genetic Alliance that we hope help enable that. A Genetic Alliance is an organization that is based in the US, but we do work internationally as well, globally. And we really are focused on transforming health by engaging individuals, families, and communities. And when we say communities, we mean any group of people who aggregate themselves together. So that could be based off of regional similar regions. It could be because they're the same, dealing with the same conditions or same symptoms of conditions. It could be other interests that bring people together. But we really think that when groups come together, there's really a lot of power there and that they can leverage for change. A lot of people probably in this room know about Genetic Alliance because of our current president and CEO, Sharon Terry. Her story is one that is very inspirational. When her children were young, they were found to have a rare disorder called PXE. Her and her husband had no background in science, but they went and said something has to be done, and they formed the disease advocacy organization, PXE International. From there, they went and actually worked side by side, literally, with the scientists that helped discover the gene. They even were able to be one of the names on the patent of the gene, which is very rare for someone who is a layman or who isn't a traditionally educated scientist. But then they thought that was too small, and they really wanted to be able to expand their work and to be able to see what they can do for a range of different conditions, not just their own. Genetic Alliance is really a network model. We are based with our disease advocacy and support groups. There are over 1,100 of those within our network. But then we also work with a range of other organizations, from hospitals, professional societies, government groups, really the whole range, because we think that it's critical that there are these partnerships across sectors to really be able to make an impact that we want to. And within our network, we have about 10,000 different organizations, and we have ranging relationships with them. It's not a membership base, there's no fee associated with that, but we really look to partner with as many different people as possible. So just a few highlights. Genetic Alliance was founded in 1986. We are very close to celebrating our 30th anniversary, which we are thrilled about, and really wouldn't be possible with some of the people in this room who really helped support our work. But it was founded by a social worker named Joan Weiss, and she really believed that the leaders of the advocacy and disease support groups, they needed a place to go where they could learn, where they can have information about what does it mean to start an organization, what does it mean to start participating in research, and that was the foundation of the organization. In 2013, the Genetic Alliance Registry and Biobank was formed, and this is really based on a co-op model where we all know, I think there's even a poster that talks about our registry's worth it outside, and we know that those can be very expensive, and this is a way that it's a shared platform that can really help cut down the cost for small organizations or groups that want to have a registry or biobank. And it's a co-op model, meaning that we provide the platform, but it's the group and the organization that owns the data, that makes the rules in terms of inclusion, and still maintains control over that. And within this current decade, we've really focused on creating tools to help people get the information that they need. A couple examples of that is Baby's First Test, which is the U.S.'s newborn screening clearinghouse. It has information on all the conditions that are part of newborn screening. Earlier this year, we launched it in Spanish, which we're very excited about. It has, like I said, detailed information about all the different conditions, resources, and so we're excited to be able to work on that. So I've talked a bit about engagement, and we think engagement is key to really being able to move different initiatives along. And what I mean by that is it's not just that, oh, you know, in this country or in that country, there's another organization that's similar to you or is doing similar work that you're doing. But it's really crucial that we connect with each other and we share those lessons learned. And that takes relationship building, it takes time, it takes effort. But out of that, you can really be able to learn a lot and move the cause much faster. And that there really need to be initiatives in place to help that, which is why it's so great for me to be here at ICORD, because it's such a great organization who's really fostered that connection across country lines all over the globe, and knowing it's not one size fits all, but there's still a lot that we can learn from each other. One thing that is very important to know is that once you have crossed that diagnosed line and you hear that you or your family member is diagnosed, it doesn't matter what country you're from or what your healthcare system looks like, we're all looking for the same thing, which is answers and a clear sense of what are the next steps for better health. And it's really important for us to aggregate and come together around that. So this is a slide that talks about the building of advocacy over, I guess, the past 50, 60 years. I'll start in the 1990s. This is a time when the idea of patient power really came into play. And I was actually at yesterday in the discussion group that was about crowdsourcing and social media, and someone said, you know, right now we have Facebook, but before that we had Yahoo groups, and before that there was something else. You know, since the 90s, really using the internet, people have been able to come together and really help determine what is best for their communities. And that really helped move into the age of what we call research advocacy, where you see advocacy groups really across the world, not just focused on support, which is very important in helping families get through things day by day, but also starting to set the research initiative, saying, you know, we live with this disease or this condition day in and day out. This is what we really think is important. This is the data that we think needs to be collected to help alleviate the issues that we're dealing with. You know, this also happened during the time of moving into what's called the information age. I think at this point, sometimes it feels like information overload age. There's so much going on, there's so much information. And because of that, because there's so much access to information, it makes it even that much more important that organizations are able to collaborate across borders and throughout the world, because it can be very easy, especially if you're just starting out, to not know where to go, to be overwhelmed with the information, and to not be able to tell what's the right information, what's current, is this paper from 10 years ago still relevant or not. Again, this is why it's really important to be able to build those channels of communication within different organizations throughout the world. You know, throughout the clinical research paradigm, you could say, there's a need for patient voices. And I put an emphasis on the voices, that there's more than one. I can't tell you how many conferences and articles that I read that talk about the patient perspective. There's not one. It's not one size fits all. We all are living our lives and have different factors that are factoring into that. And so it's important to pull from all those experiences. To be able to look and say, okay, an educational program in one country, you know, some groups use videos to communicate, and that's really great. But videos isn't going to necessarily work in another country or in another culture. You really need that one-on-one, face-to-face time. And it's important for us all to learn about that, because by sharing those experiences, we all can get better. We can all improve the research that we're engaged in, or in the grassroots support that we're involved in, is by being able to learn and seeing what's happening in different communities. So while I don't like to focus on the negative, I think it's important to identify some of the barriers that sometimes come up when you're looking at international collaborations. At Genetic Alliance, we work with a range of different organizations, and sometimes you see around a particular condition group, the group's not really being able to work well together because they have conflicting priorities. And I have to say, there's nothing more heartbreaking than seeing people not be able to get past that, but it's a reality. You know, you have one group that feels resources should go to support services, and they have another group that thinks research is the key. These are all important, and it's important for us to be able to move beyond that, but that is a very real factor, that sometimes there are conflicts of priorities. There's also issues of having varying regulatory funding mechanisms. It can feel like a hurdle to understand what's going on over there, because it's different than what's going on in my day-to-day life. Also issues of differing healthcare systems. And I could probably fill this up with all the barriers. But I think it's important when you get bogged down in the barriers and what's not working to remember kind of two really important questions. And that is, what is truly at stake and what really matters most. And I think we would all say it isn't the regulatory system, or it isn't the funding, but it's how do we get to better health and better well-being for those affected by these different conditions. And I think when we can reorient ourselves back to that kind of guiding light, you can then really be able to move forward in partnerships. And this is something that, while it's important for the disease advocacy groups themselves to do and to find ways to come together cross-condition, globally, it's also important for everyone who's involved in rare disease. By supporting that work and initiative to connect at that higher level of what's at stake and that better well-being, we all will be able to move much further. But there's a role for everyone, both those patient advocacy groups and then also those of us who work on funding them or work in partnership with them to really help move those causes along. So now I'm going to quickly go through just a couple of tools that we have at Genetic Alliance that help with that. Unfortunately, this slide will probably be almost obsolete in a couple of weeks. We're doing a redesign of our disease info search, but it has information on, I want to say at this point, I think detailed information on 3,000 different conditions. that has been populated by the disease advocacy groups themselves in partnership with our in-house genetic counselor. We have information about different advocacy groups. So the idea is if someone has just been diagnosed and they don't know where to go, they can come here and say, oh, this is a local advocacy organization, or this is a group that I can connect with and get more information. We currently pull articles from PubMed to make sure that there's access to the latest research and information. And we also have information about clinical trials. Now, this currently is pulled just from clinical trials for the US, but we are very interested in trying to see how do we highlight clinical trials or other activities happening internationally. We have this Navigating the Ecosystem of Translational Science, which we call NETS. And basically this is to highlight what it takes to go from the bench science or the basic science to getting a treatment. Now this can look like a mess, but it really is broken down into what we call different neighborhoods. And I'm trying to speak straight. And so what that means is, so this is kind of one type of work and activity. Down here, this represents what you need for clinical trials. Up here, it's more around assay development. And why we think this is important, and you can go to our website